Hi, my name is Yasmin, Yasmin. Last name is Taki. This is my ID, and this is my picture. Okay. I'm going to be showing you around. Okay. And this is my partner. Okay. Okay. So the vitals that we have in this scenario, patient has fever. Therefore, if doctor has ordered acetaminophen, I can give it to the patient. If doctor has ordered IV fluid, we can give it to the patient for low maintenance, because usually patient with fever has, they can be dehydrated. I can also put a cold cloth on their head to reduce the fever as a nursing intervention. Their respiratory is on 22 because based on their age range, it is on normal range and development. Their tachycardia, it could be infection or it could be a fever process. Therefore, as a nurse, I'm gonna check patient every 15 to 30 minutes, and if it's higher than what it is, I can let the MD know. The blood pressure is also on the normal range. So I'm gonna be asking you for neuro question. Do you have headache?
Yes, my neck is really stiff.
Any injury?
No.
Any dizziness?
Yes, I feel dizzy and it's making me nauseous.
Any shortness of breath?
No.
Any pain when you're breathing?
No, but my chest hurts a little bit.
And when you're coughing, do you cough?
Yes, I have a cough, but it's not too bad.
Okay, is it productive or dry?
It's dry.
Okay, so I'm gonna be checking your headache. When did it start?
A day ago. It's worse today.
Okay, and what makes it worse?
Movement and light.
What makes it better?
Falling asleep.
How would you describe your pain as?
Feels like throbbing.
And where is your headache?
All over my head.
Does it radiate anywhere else?
It doesn't spread. No.
Okay, and how would 0 is no pain, 10 is a lot of pain. How much pain would you tell it is?
8 out of 10 the worst.
And when is the pain
all
occurring?
the time.
Okay, and how would you describe your pain as?
8 out of 10.
And what do you think it is?
I don't know. I just feel really sick.
Okay, so one pain management that I would do for this patient is non-pharmacological, is that I will dim the light that can reduce the patient's sensitivity, as well as if the family member is close by, I can ask for cognitive behavior therapy, means I can ask the family member to patient occupied, which patient will be not focusing on pain all the time. Now when I'm looking at my patient is lethargic, they're weak. Patient is also irritated, but they're cooperating well. Their respiratory rate is on a normal range, and they have neutral rigidity. When I'm looking at patient's mucosa membrane, it is there's no cyanosis. They're alert to place, time, and person. They are not even having any respiratory distress. And they're not using any accessory muscle. My patient's GCS is 15 because their eyes are opening spontaneously. They have the best verbal response, and they're following command. Now I'm going to be doing eye assessment on my patient. So first of all, I'm going to be looking at the pupil size. So both of them are equal. They're round, and the size I'm looking at is 3 here. So please look at this. The eyes is constructing and dilating well. And I'm looking at the other side, constructing and dilating well. Okay. So patient's pupils are equal, round, reactive to light. And one more thing I want to do is follow this. Okay. And they are accommodating. Now I'm going to be checking patient's grip. So can you hold it tight, press on it? Thank you. Bring your legs up, please, and press on it. Press against it. Okay. The grip is good. Now I'm going to be auscultating my patient. Okay. Would you mind turning back? Okay. Thank you. You can have a seat. So the abnormal sound that I'm going to hear in this patient situation is going to be rales. The normal sound is going to be bronchial, which is going to be heard here. It's going to be high pitch. Bronchiovesicular, which is going to be medium pitch, and vesicular will be low pitch. Now I'm going to be calling the doctor, and I'm calling Dr. K. My name is Yasmin. I'm RN student from ER department. My patient is 17-year-old male, came in with a complaint of severity and headache. They also have stiff neck, they have chest pain, and they have mild cough. Patient is diabetic 1. Their headache started yesterday and it's worse today. Patient is also allergic to penicillin and they are diabetic 1. Upon assessment, I noticed patient is alert oriented times 3. Their GCS is 15. Patient is also on auscultation. I heard rales. As well as when I'm checking patients' vital, they had fever, 103 Fahrenheit. Their blood pressure was 115/70. Their heart rate was 115, and their respiration was 22. Doctor, I would recommend for you to come and assess the patient further to determine what's causing the patient's symptoms, as well as comfort measures have been offered to this patient, such as IV fluids, pain medication, and non-pharmacological interventions. What I think patient is going through is pneumococcal meningitis, because patient has respiratory symptoms, as well as because patient is diabetic, so they are high risk for getting that. As a nursing intervention, what I would do is patient has diabetic 1, so I'll check their blood glucose because we don't want adverse effect with the infection, as well as I will get an IV line open because doctor will order ceftriaxone, which is a broad syndrome for infection. Doctor's order will be blood work to check what is causing the infection, as well as infection blood work to see if patient is a candidate for lumbar puncture. Thank you.